Hi everyone, my name is Dr. Ashimi. I work for IMGC Clerkships. I'm a professor that helps teach their USMLE board review programs. We've developed a few videos to help you identify skills to answer questions efficiently and also learn key concepts that are required to do well on the USMLE board exam.
Hi guys, so we're going to discuss a hematology question. I always say begin with the question and identify what's being asked, as this is the most important thing. The question is asking us which of the following is the most likely diagnosis. So we're looking for a diagnosis. Then you want to look at your answer options to get an idea of what organ system is being discussed, and this is going to help streamline your thought process and help you identify what is important within inside the vignette and the diagnostic studies that are being presented. Next, you're going to go to the diagnostic studies, and we have some laboratory values here. So we look at the hemoglobin, we know it's within normal range. The leukocyte count and its differentials are also within normal range. The mean corpuscular volume, normal, is between 80 to 100, so 82.2 is within normal range. But the platelet count, however, is 20,000. So this patient has thrombocytopenia, decreased platelet counts. So now we have to then come up and decide, do we know any disease processes that specifically target platelets and there is no other abnormalities? And the answer to that question is yes. And also, you can identify that here in your answers. G, immune thrombocytopenic purpura, is a disease process where you build, either idiopathically or due to a previous infection, autoantibodies that target the protein that's found on your platelets. So your platelets will be then destroyed and sequestered because of the antibodies, and everything else will remain within normal value. And this is what we have here. But let's go to your answer options and make sure we haven't missed anything. So our first answer, acute megakaryocytic leukemia. This process is due to a breakdown of platelets, but it's a leukemia. And you know that in leukemia, your laboratory studies usually increase because of overproduction of cells, not an underproduction of cells. Acute myelogenous leukemia is another leukemia or a blood cancer that results in increased blood product, specifically within inside the bone. Aplastic anemia is a disease process where your bone marrow fails to produce any new cells. And we know that based on our cell lines that most of them fall within normal values, that's not going to be an answer option for us either. Epstein-Barr virus is a virus that specifically targets immune cells, B cells particularly, and destroys them. That being said, we know that this patient doesn't have an infective process because if we look at the leukocyte count, it's within normal range. And normally when we go through an infective process, our leukocyte count increases. Next, papillovirus infection. Again, another infective process that we would anticipate our leukocyte count and the differentials, specifically since we're talking about a viral etiology, our lymphocyte count would be increased, and again, this is within normal range. And then thrombotic thrombocytopenic purpura, or TTP, is a disease process where you have a deficiency in ADAM's TS13, which is a metalloprotease enzyme that specifically is used to cleave multimers of von Willebrand factor, and this results in a sequesterization and aggregation of von Willebrand and platelets, which then would result in thrombuses being formed inside the blood, schistocytes being created as blood RBCs pass through. They're going to shear off these thrombi and create schistocytes, and you're going to have decreased hemoglobin levels as a result, with other manifestations like CNS changes, neurological problems, and possibly end organ damage. And again, based on our laboratory values, we know we don't have hemolytic anemia because our hemoglobin levels is within normal range as well. So the only answer option that would make sense, again, going back to the fact that our laboratory value shows thrombocytopenia, is immune thrombocytopenic purpura, ITP, or an autoimmune disease that specifically targets your platelets.